Back now at 8:37 on the final day of Feeling Better Head to Toe. More than 100 million Americans live with chronic pain, and relief could be within reach thanks to alternative treatments that are quickly becoming mainstream. In recent years, Eastern medicine practices have made their way into Western doctors' offices. And what it could mean is relief for millions who are suffering from pain.
I have just in the last 5 years seen a shift where people have gone from asking what acupuncture is or thinking hypnosis is weird to really wanting it and incorporating it into their regimens.
Data from the National Health Interview Survey shows that more than 40% of Americans now integrate one or more unconventional health practices into their personal health care. Herbal remedies, hypnosis, yoga, and meditation, to name a few. And it's a big business, a multi-billion-dollar industry. Even the American Pain Society recommends massage therapy for treating lower back pain.
Massage will boost serotonin levels, it will boost endorphins, and in some studies it's shown to really help heal post-operative recovery.
And fast becoming mainstream, acupuncture. One study found that alternative therapies like acupuncture are now offered in nearly half of all hospitals surveyed, alongside traditional treatments.
Patients will undergo acupuncture and then have a nice release of opioids, which are natural painkillers.
That's welcome news to those who have tried everything else.
There's a lot of hope for people with pain.
Well, insurance companies are actually starting to pay for some of these treatment methods, which should be noticed. This doesn't work for everyone. So let's start demonstrating. We've got acupuncture first. We have Dr. Daniel Hsu. Good morning to you.
Morning, Doc.
So Matt is our patient. Just tell me what you're treating him with and why acupuncture works.
Well, Matt's got a couple needles in him right now. And look, all acupuncture needles are about 0.5 millimeter away from a nerve. They all talk to the brain. They make the body produce natural occurring painkillers that help lower pain, but they also work on parts of the brain that help to control all parts of the body.
So can you get acupuncture even if you don't have a particular ailment you're trying to treat?
Yeah, a lot of people get acupuncture just to feel better, just as a therapy for relaxation. It works very well for that, too.
Do you have any needles to put in Matt's ear?
Sure do.
It's just part of the segment.
Is a long dream of yours come true? Is that it?
She told me to stick it in your eye. Yeah, I'm going to stick it in your ear instead, okay?
Okay, go ahead. And by the way, this does not hurt at all.
Okay, good.
Ow! No, not at all. Seriously.
Now you know why I want to stick the needle in.
Really? I've done this. I've gone to an acupuncturist to help with sleeping.
Yeah.
And okay, so there's also one, because some people, the needles freak them out even if they don't hurt. You've got a non-needle therapy that I'm going to try, right?
We're going to do one more on Matt's head.
Okay.
Just like that.
That looks great.
Okay.
That's your Halloween costume.
And how long are you supposed to sit there with the needles?
Well, it depends. Sometimes 20 minutes, sometimes an hour. It depends.
Okay.
Yeah. Okay.
All right, let's do my non-needle therapy real quick. Is it?
Yeah, it's not bad.
You sure you want to do non-needles or no needles?
Just a needle, right? Okay, yes. Whatever you want.
Well, the non-needle therapy would be an acupuncture cold laser.
Okay.
And the cold laser works very well for people who are needle phobic or for people who have, for some reason, heart problems, anything that doesn't require or can't get needles. So it's a cold laser needle. It's also... Here you go.
Okay.
You can see it like that. You can see the light. All right. So what I'll do is I'll put it on parts of her body. Let's say her ear. We'll turn her head slightly sideways. And we'll go like that.
You feel it at all?
No. Are you doing it?
Right. It's completely painless.
Yeah, it is painless.
And you hold it there for 10 to 15 seconds at a time. And it does a lot of the same effects that acupuncture needles do also.
Okay.
Yeah.
All right, cool.
Yeah.
We're going to move on. Thank you very much, Dr. Hsu. Move on to the feet. Jenna Bush-Hager is our patient. She says the dogs are commonly barking and she needs some help. Why do we need to pamper our feet?
Well, feet are our foundation. Any misstep and you're going to end up with a painful foot. If you're wearing wrong shoes, like Jenna here has plantar fasciitis.
She sure does.
Lots of pain at the bottom of the foot.
It's not contagious. Okay, good. So tell me about this new therapy. What is this?
What this is deep IR. It's an actual infrared at low energy levels. And it doesn't hurt, and it's good for most people with painful feet.
All right, let's do it. And it's just going to relieve the pain?
Okay, so a little laser. It's like a little IR, and what it does is it's applied. There's a cool tip.
Has it gone?
Well, we're getting it on.
Oh, okay. Maybe your feet are especially difficult.
They have a little extra layer. You have a little layer callus here that probably has to be removed.
Did it go?
Oh.
Okay, let's...
Oh, shoot. My foot's special case, probably.
Did it work?
Ooh, let's see.
We might have to come back to that.
Let's see.
All right, one more try, Jenna.
Okay, here, let's see. Here it
Instead,
comes.
here it is. Oh, it's glowing.
Whoa. Okay, it's glowing.
It's like E.T.
This feels great. She actually has calluses, so her feet are a little cold.
Just to repeat.
Have to be heated up. Yeah, it's because I exercise.
Oh, is that why? Okay. All right, well, we've got to move on.
Okay.
So, did you enjoy it? Does it feel good?
Really good. I have a bad arch. Thank you.
Are you ticklish in addition to your calluses? Okay. Let's go over to Natalie. Inversion therapy. Sandra Foschi is a physical therapist. As we turn Natalie upside down, tell us how this works.
This inversion is great for elongating the spine, taking pressure off of the joints, bringing oxygen to the brain, and increasing circulation.
Here we go.
Let's go.
Lucky me. Just don't leave me up here.
Nice and slowly. And Natalie is in great shape, so we can move really quickly. You can let go of the handles.
How does it feel, Nat?
I feel like the blood is rushing to my head.
Well, yeah, normally you think that it's not good for the blood to rush to your head.
But that's another benefit of increased circulation, great rosy glow, and you just want to make sure that you move up slowly. If you have high blood pressure or glaucoma, you do want to check in with your physician.
How long do you leave me hanging?
Yeah, how long?
Till the 9 o'clock hour?
No, Sandra, come on. Bye, Natalie. Have a good time. We're leaving you. No, I'm just kidding. Al's got one other kind of unconventional treatment over there in the orange room with Carson.
Yeah. You have chronic knee pain.
Exactly.
And my alternative method is to take a pumpkin carver and I do a little surgery on them like that.
Actually, I wear these pain patches, basically, and put one on each knee.
Every day you do
Every
that?
day. Do it every day.
Is there something on that patch that goes through your skin?
Yeah, it's supposedly
medicinal?
Transdermally transmits medicine right into the joint. So.
And you feel that relief?
Yeah, I do, and it's got a nice soothing aroma.
Is it over the counter? You got RX for that?
It's over the counter. You can see these pain patches. You see a lot of athletes advertise.
They make big ones for the lower back because I can use that.
They do.
No kidding.
Absolutely.
Well, there you go. By the way, this is Michael, our pumpkin carver.
Oh.
We are live streaming today.com if you want to watch that. We asked you to tweet in #OrangeRoom, and literally number one request, I kid you not, Al Roker.
Get out of here.
This will be a Roker pumpkin within how long, Michael? Another day or two? Or?
Yeah, give me a couple days.
Hopefully within the next hour.
For Halloween.
Back to you.
Carson, thank you so much. Hey, you know what, Natalie? I'm so exhausted by this segment. Do you think you could do the tease?
Coming up, doggy doppelgangers. Right after, I have to read upside down, too. Come on. Right after.